Well, basically we looked at how we did family-centered rounds and found that we needed to become more family-centered. In an effort to do that, we changed our whole process. We decided that we wanted to take an approach in which our multidisciplinary team would go in and we would really embrace the family and embrace the patient and involve them in the decision-making for the day as well as in preparation for clinical readiness for discharge. So we have completely revised the way that we do our rounds and really focusing on the family and bringing the family in as an active participant in the plan of care for the day. In essence, we rounded more as a healthcare team and really did embrace the family. So the way we changed our approach was to really take our family and put them in the center of our rounding process. We utilize the family's input, we value the things that they have to offer, and we ask them to be a participant in making the plan of care. And I think that empowers families to have a trusting relationship with us and really feel like they understand what the plan is. And in essence, it's a safer culture for us. We try to prep them a little bit. There's a big group of, our service is rather large, so we typically round with 12 to 16 people. So ahead of time we will prep the family and let them know the size of the group. We will let them know kind of how the rounds look to them and really just ask them to be open. It's a great time to ask questions. It's a great time to bring up concerns and they have all of our attention. So we really just let them know ahead of time this is not a scary event. If anything, families really seem to enjoy it, and if they by chance miss us, they're very disappointed. Then we make good attempt to go back and catch them later in the day. There have been things that we have maybe brought to a family's attention, and first and foremost, we need to remember that our patients' families know the patient the best. And they very readily will tell us that that's not the best choice, and it allows us to have an open mind when we're making a plan of care, especially when we're dealing with maybe a rather ill child or a chronic child. I think the most important thing is just to utilize what the family has to say and put them up at the forefront of the decision making. It's a new experience, especially for people who have rounded more from the healthcare perspective. In the past, our rounds were very medically driven, a lot of medical education, lingo that parents and families just didn't understand. So we've tried to take a lot of that out, and when we walk into a room and we want to talk about the plan of the day, we talk to the family in a way that they can understand and in a way that it just makes sense for them. That has been a culture shift for all of us. We still have our time outside of the family room where we have more education. We are a teaching hospital, and we really want to look at education is still important and on the forefront for our medical team. But when we're in that family's room, what's most important for that family is that we are all on the same page and we are creating a goal for the family in which they are a part of. So that has definitely been a culture shift for all of us.